their economic status is, since, you know, generationally they haven't had shit. What are your thoughts on like UBI and stuff, like universal basic income? Do you think?
I mean, I think it. Okay, all that can work,
Mm-hmm.
but you have to get to baseline first. You know what I mean? You have
Yeah.
to get to a baseline before you start doing that. You got to make sure that
Yeah.
everyone's at a baseline, and then
Yeah.
I would say that could only work if you have universal health care first.
Yeah.
Because I mean, what is giving me $1,000 if it's all going to medicine,
Yeah.
right?
Yeah.
So I'd say take care of healthcare first,
Yeah.
right? But all this stuff that like, I did a podcast. Remember, I was telling you, it was almost 89,000 views. Shout out Sean Atwood.
Shout out, Sean.
Sean Atwood. But you know, the other thing too, it's not like this podcast because I had to say SA. You couldn't talk about trans people. You couldn't talk about this or that, and and I thought about that for a minute, and because you can't talk about things, there's less understanding about things.
Yeah.
It's not always about, you know, it's like with Kanye going off on this Nazi thing, right?
Mm-hmm.
Like maybe people would understand. Like, I mean, like there's so much misunderstood stuff about like what that was and how it happened and how we can't let that happen again. Do you know what I mean?
Yeah.
I mean,
Yeah.
it's wild. It's wild to me.
Our mental health as a collective, as a nation, is not that great. And I think I don't know if I don't think it's the government's responsibility
Right.
to provide us with mental health outlets. However, it would help. You know what I mean? It would be something, I think, that it's almost like having a YMCA or a community center or someplace you can go do yoga or exercise or some shit.